Yeah, it's a pleasure to do this presentation, and thank the college for this opportunity. I will be very brief in covering this because this is quite a straightforward subject. So so basically, as you've seen with in Giles' presentation, very similar requirements exist for training opportunities in South Africa. So the applicant has to have a basic medical qualification, and then they need to go through the process of registering with the local medical council, the Health Professions Council of South Africa. And the steps for that are very similar to uh, has been outlined by Giles. So there's a requirement for ECFMG recognition, and also ECFMG verification. And there's also there has to be an endorsement from the Department of Health in South Africa, because one of the things that we are conscious of is poaching staff from other countries. So there has to be an endorsement from both the Department of Health in South Africa and the Department of Health in the country of origin. And then basically the selection is based on prior academic performance and clinical experience. Next slide, please. So we've had usually the trainees we get are from the immediate neighboring countries, or what we call the SADC countries, the South African development region, the SADC countries. That includes Botswana, Zimbabwe, Zambia, for example, or Malawi, and also Namibia. So the trainees we've had thus far have come from those countries, and usually they also are sponsored by they're sponsored by their governments as well. So their salaries, etc., are paid for by their governments, and so that's usually the arrangement. And the program structure is very similar to what you would see in most Anglophone training systems. You have theoretical training, practical training, some clinical training, and then you have to do a research component. So the theoretical training is, as you would expect, science, pathophysiology, laboratory principles, and then clinical applications, including interpretation and integration with practice. And then practical training, obviously, because it's a laboratory-based specialty. And then depending on the interests of the department and the individual, there could be more specialized training in different areas, like endocrinology, for example, or metabolic disorders. Now, clinical training, since it's different from the UK, where we're still largely laboratory based. So, and that's similar to what you'd find in other countries in Africa, or for example, in Hong Kong, Malaysia, Singapore, for example. The programs are still largely laboratory based, but there is a slow evolution towards more clinical training. We haven't reached the level of the UK, where you have metabolic medicine and you have a more in-depth clinical training requirement. But I think that's going to happen in the future, and then probably I think the Australian system also has some clinical training, but it's not as in-depth as say the UK. But there is a requirement for trainees to develop clinical interests, and then to participate in ward rounds, in outpatient clinics, and interdisciplinary meetings. And then obviously part of the training will involve clinical liaison for dealing with complex disorders. So the training in South Africa also requires a research component, and It's part of the Master of Medicine degree, which is a requirement for registrars in training. They have to register for that degree, and they have to do a research project for that. So that involves a suitable research project. They have to produce a dissertation or a journal publication, and that usually satisfies the requirements. Most people, if they're lucky and they've got a project they can publish in the journal, they can, it sort of overcomes the requirement for having a formal dissertation, which has to be sent to examiners and marked. And then we have examinations and assessments. So you have an intermediate exam, which we call the part one, which is basically foundational knowledge, and then the exit exam, which is the final exam. And the body that administers that is the Colleges of Medicine of South Africa. Upon successful completion of the exam, the candidate is awarded the fellowship of the College of Pathologists. So the College of Pathologists is a sub-college of the College of Medicine. So it's different from the UK structure where you have an independent College of Pathologists. In South Africa, it falls under a big umbrella college called the Colleges of Medicine. But you get a fellowship from that body, and then there's a requirement for continuous assessments in addition to examinations, obviously, and there's summative assessment. There's also formative assessments based on the logbooks and the supervisor evaluations, and there's a requirement for that to be a formal record. These are all the accredited training institutions. So the 7 universities that have training programs for chemical pathology, and depending on so a prospective applicant, depending on the city that they want to work in, they would approach that particular department in that university, approach the head of department, and then start the process of discussing maybe a future either a fully fledged registrar training stint, which obviously will cover 4 years, or any other short-term funded training opportunity. So there are various bodies that can provide short-term visits for training purposes. So it doesn't have to be the full-blown training program. There's a possibility that you can come for a few months to learn a specialized technique in one of the universities, and obviously that would suit some individuals much better. There are huge opportunities for anyone wanting to train because we have a very diverse disease spectrum. So there's an opportunity for training. We also have a good academic infrastructure. So there's opportunity to get mentorship from quite a few leading experts. And there's also an opportunity to do research, especially in the larger universities which may have, good laboratory resources, etc. Obviously, we have the same challenges as every other country with limited resources and high workloads. And then we also have a situation where the big hospitals are situated in the big cities, and then you're separated by these vast areas of rural provinces. So again, that's very similar to what you may find in other countries. But having said that, I think there are huge opportunities for anyone who wants to train. So I think that was the last year. So that was the end of the presentation. So just to summarize, I've given you an overview of the possibilities that exist in South Africa and how you can, our prospective candidates can actually embark on either setting up a full-time training program or even, a short-term visit. Thank you very much for your attention.